So GERD actually stands for GERD, which is gastroesophageal reflux disease. Now this is a problem that affects a lot of people and it is extremely common. What happens during GERD is that the valve that connects the stomach to the esophagus, and the esophagus connects from the throat, and it's a muscular tube that goes down into the stomach. There is a valve at the opening around this area that usually opens when the food goes through and then closes tightly after that. In people who have GERD, what happens is the valve is faulty and instead of staying closed, it remains partially open. So when this happens, if you have food or liquid in your stomach, there's a chance that the air may come up together with the acid and the food contents can come out. And typically, people who have the problem with GERD will experience pain that's located right in the center. Between the breastbone and the rib cage, they'll experience sharp pain at this area. And this is actually where the esophagus is, and this is where the nerves are very sensitive to acid. Now, if the acid goes up higher, they experience chest discomfort. And this is commonly mistaken as a heart attack. And that's why people always end up seeing a doctor and they are directed to the cardiologist thinking that they have a heart attack. And that is not wrong because we always worry about a heart problem before we think about reflux. And if the acid goes up further, it can cause irritations to the throat. Some people may experience a lump in their throat, a sensation of a sandy feeling in their throat, or their voices may go hoarse, or sometimes they experience a lot of phlegm. And very rarely, the acid or the food actually goes into the lungs and then they get a chest infection. So these are the common symptoms of GERD. Now, GERD can also present with bloating, symptoms of bloating and burping as well because the air is moving in and out. Sometimes people have got problems with the stomach and they think it's GERD, but actually the problem is an infection like Helicobacter pylori in the stomach. And this causes the stomach to be inflamed and very uncomfortable. So when you eat food, what happens is that the food distends the stomach and you just want to belch and get all that distension down. You want the stomach to collapse. And in order for the stomach to collapse, the air must go somewhere. So you burp and the air goes out and the acid goes out. And then they get this reflux. So when people get treated for Helicobacter pylori, the stomach gets better and then the burping gets less and then they feel that the GERD actually gets better. But actually GERD and Helicobacter pylori are two separate problems and they are really not, they do not affect each other. It's just that people mistake a gastric problem for GERD. Or the presentation may be GERD, but actually the underlying problem is a gastric problem. Otherwise, Helicobacter pylori does nothing to the esophagus. Now, one of the things about GERD is that if the inflammation persists long enough, you can get problems in the esophagus, what we call Barrett's esophagus. And this is very common in Caucasians, but very rare in Indonesians, rare in Asians, and rare in Chinese, Indians, and Malays. And we don't know why Caucasians are so prone to getting these changes called Barrett's, but we do know that anyone who has developed this is at risk of cancer of the esophagus. And so once you have been diagnosed with this problem, where there are changes in the esophagus due to chronic reflux, what we call Barrett's esophagus, one would then need screening endoscopy every few years, for instance 2 to 3 yearly endoscopies, to check and make sure that there are no developments of an early cancer.